Guys, let us see the anastomosis around the elbow joint. Okay, first of all, this is humerus. Okay, humerus bone. Okay, now the brachial artery is one of the most common artery which is present in the humerus, which passes vertically downward along the humerus. Okay, at the level of radius, it divides into two parts. One is radial artery, another one is ulnar artery. Radial artery and ulnar artery. Next, another branch of the brachial artery is nothing but profunda brachial artery. Okay, profunda brachial artery, which is a branch of brachial artery which passes up posteriorly, okay, and divides into two parts. One is anterior descending branch and posterior descending branch. The anterior descending branch comes anterior and posterior descending branch goes posteriorly and get anastomosis. Okay, I will say explain it. Okay, now this anterior descending branch will comes on the lateral side of the humerus. Okay, and now let us see the different types of or branches of brachial artery. Okay, so this branch, see this branch, this is nothing but inferior ulnar collateral artery, which is a direct branch of brachial artery, and superior ulnar collateral artery, which is also another branch of the brachial artery, which is goes posteriorly. Okay, posteriorly. This inferior ulnar collateral artery goes anteriorly. Okay. Now the ulnar artery and radial artery. The ulnar artery will divides as common interosseous artery. This common interosseous artery gives rise to two branches. One is anterior interosseous artery and posterior interosseous artery. Okay. Then the radial artery also gives rise to one branch, radial recurrent artery. Okay. The ulnar artery gives two branches, posterior ulnar recurrent artery, anterior ulnar recurrent artery. Okay. The posterior ulnar interosseous artery, right? This gives another branch name as interosseous recurrent artery. So now let us see the anastomosis of the elbow joint. Totally, there are four anastomoses around the elbow joint. 1, 2, 3, and 4. Okay, 2 on the anterior side, 2 on the posterior side. So let us see the anterior side anastomosis first of all. So first anastomosis is between the inferior ulnar collateral artery and anterior ulnar recurrent artery. Okay, this is the first anastomosis which is present in the anterior side of the elbow joint. Next, another anastomosis which is between the anterior descending branch, which is a branch of profunda brachial artery, and radial recurrent artery. Okay, so this is the second anastomosis which is present on the anterior side of the elbow joint. Next, the third anastomosis which is present on the posterior side is nothing but superior ulnar collateral artery and the branch which is from arises from the ulnar artery, nothing but posterior ulnar recurrent artery. Okay, the superior ulnar collateral artery and posterior ulnar recurrent artery. Okay, two arteries on the posterior side gets anastomosis at the elbow joint. Next, fourth anastomosis is between the okay, fourth anastomosis between the posterior descending branch and the branch which I already said arises from the posterior interosseous artery, okay, which is interosseous recurrent artery. This one, which is on the posterior side, okay. So to conclude here, let us see the superior ulnar collateral artery and the posterior ulnar recurrent artery gets anastomosis here. Next, anterior ulnar recurrent artery and inferior ulnar collateral artery gets anastomosis here. Okay, and third anastomosis between the anterior descending branch and radial recurrent branch of radial artery. Okay, this is third anastomosis. And fourth anastomosis between the posterior descending branch and between the interosseous recurrent artery, which is a branch of posterior interosseous artery. So, to conclude, there are four anastomoses which are present around the elbow joint. Okay, thank you.